Thanks so much for joining us here on 9 News Plus. I'm Chris Bianchi, joined by our 9 News medical expert, Dr. Payal Kohli. Thanks so much for joining us here, Dr. Kohli.
Hi, Chris. Thanks for having me.
Should mention what we're going to be speaking about is the monkeypox. I wouldn't call it, it's not a pandemic yet, it's not close to it, but the emergence of a few cases of it here in the United States and across the world. Dr. Kohli, I think it's obviously a point of interest in light of COVID-19. What are the top line things that we know about the monkeypox outbreak at this point?
I think very important for us to know this is not a new virus.
Okay.
It's been around since the 1950s, so very different from the SARS-CoV-2 virus, which causes the COVID infection. The other thing to know is that we have a vaccine specific to monkeypox, and that the smallpox vaccine, which anyone born before 1972 got, covers against monkeypox. And the third is that in order to be transmitted, so the way that it transmits is a lot less contagious than COVID, requires a much more prolonged and closer contact. So it's actually spread directly through bodily fluids, respiratory droplets, and other secretions, through broken skin, through mucous membranes like your eyes, your nose, your mouth, and through contaminated bed sheets or clothing. So it's transmitted slightly differently than COVID, but much less efficiently. So we don't worry as much about as quick an outbreak. It allows us time to do contact tracing because it also takes a longer time to manifest. The incubation period is 1 to 2 weeks.
So it's not airborne like COVID-19, correct?
That's right. So it doesn't have aerosol spread, so it doesn't linger in the air after the person leaves. You actually have to come into contact with their saliva, their droplets, or their other secretions, or things that they've touched in order for you to catch it.
So the transmissibility is lower. What are some of the symptoms that you would have if you were to have it?
So, in the early stages, Chris, it looks a lot like a flu or even like COVID. You have fevers, you have chills, you have muscle aches, you have fatigue. One of the differences that's pretty notable is the swollen lymph nodes. So you can get lumps or bumps in, here in your neck, under your jaw, in your armpit, in your groin. That's where your lymph nodes live. And those can become swollen and potentially even tender. And then a few days into it, you actually start to develop a rash. That's where the pox comes in from, and that rash looks like a chickenpox rash, but it's basically vesicles or pimples or pustules that form first on your face, and then they can spread over the rest of the skin and the genitalia. They can be on the surfaces of your hands as well.
Okay, so let's say you have some of those symptoms. What should you do if you think you have it?
First thing, very important, is isolate yourself from your family members, from your friends, even your pets. Actually, isolate yourself because animals can be reservoirs. And then you call your doctor, because they'll need to put you in something called a negative pressure room, do some tests to try to figure out if it really is a case of monkeypox or not. And we are learning, based on what we have seen so far, that there is community spread, meaning person-to-person transmission, so you don't actually have to go to the host in Africa in order to catch it. Even people who haven't traveled are catching it from others who are infected.
As we say this, I think there's only been a few cases of it here in the United States. What is your concern about a potential major outbreak of it here in the U.S.?
Pretty low at this time. And I think the reason is because we're equipped with those vaccines and we have a longer runway to diagnose and contact trace when there's an outbreak because of that long incubation period. So, there is a strategy called ring vaccination that we could potentially employ, which basically means that if somebody is positive, anyone who might have been a close contact to them also gets isolated and vaccinated, and you kind of wait out the incubation period. So because we have those tools, we have time on our hands and we have a vaccine, the likelihood of it spreading the way that COVID did, which is aerosol spread, obviously, is much, much lower.
So I'm going to infer here that COVID remains a much greater concern to you than the monkeypox right now?
Very much so, yes. And I think we need to continue, given the number of cases and given the fact that our immunity is going down, we're not wearing masks in most indoor places, really keep our guard up for COVID infections. Having said that, there are obviously certain risk factors that potentially could put you at higher risk for monkeypox. If you have come into close contact with anyone who may be positive, may have traveled to Africa, you certainly want to practice those preventive measures.
Well, back to monkeypox, if you do have it, how much more likely is it to lead to serious disease or perhaps death than COVID or in general?
It depends on the COVID variant, because remember those earlier variants, particularly the Delta, the case fatality rate or the number of people that died after getting it was a lot higher. Now with Omicron and the vaccines, it's a lot lower. With monkeypox, it's a little bit variable. The numbers that we have, some of them come from Africa, where the rate of vaccinations against smallpox might be lower, and the strain might be more aggressive, just like the COVID variants. So it can be as high as 10% of people dying from it, from the one that was in Africa. But the good news is that the World Health Organization says that the variant that's circulating, at least in Europe, which is likely the variant over here as well, is the milder one that only has a mortality of about 1%. Still pretty high, but not nearly as high as we see in Africa, and obviously lower if you have some protection with the smallpox vaccine, as some of us before 1972 got that.
And put that in perspective, COVID mortality is about 1% as well, correct?
That's right.
So the one that's circulating in Europe is about that of COVID. Am I getting that roughly correct? I know that's not perfect. But.
Yeah, about so, I would say. I mean, a little different again because we don't have a large volume of population infected, so we're drawing our conclusions based on smaller numbers. But yes, probably the risk of complications, because it can be serious, starts as a systemic illness, it can get into your lungs and your organs and such, is probably comparable to what we're seeing in high-risk people that get COVID.
Okay. So I guess with that in mind, the vaccination, you mentioned that. I'm kind of curious a bit more about that. There is an active vaccine. Is there a chance that the government or CDC decides to implement a vaccine for everybody?
Yeah, mass vaccination strategy I think is unlikely because of the cost and also the necessity and effectiveness, particularly when you have a handful of cases that we're talking about. But the good news is that we have those vaccines available, both the smallpox, which we think has about an 85% protection, cross-protection against monkeypox. Now that protection does go down over time, so if you got it when you were a baby, it may have waned down a little bit. But that monkeypox vaccine, which we normally had previously reserved to only really use in people who are working in labs or high risk for exposure to monkeypox, is something we could launch on a small scale in little pockets where we have outbreaks, not necessarily across the entire country. The interesting thing about this vaccine, it is a different type of vaccine, a live attenuated vaccine, which means it's actually the live virus but diluted down. But it's been FDA approved now for several years, and it is very effective, obviously, at preventing infection.
Any final thoughts, anything that the public should know about the monkeypox?
I think it's getting a lot of attention because of its name, because of those pictures where it looks very scary. But I do want to make the point that it requires prolonged close contact. I also want to make the point that we're seeing it in a specific demographic, men who have sex with men. And that could be because of behavioral reasons, just because they have close contact with other men. Or it potentially could be that the virus might have changed a little bit and perhaps it's being more concentrated into bodily fluids. The second part we're still sort of looking into, is this virus a little different than the monkeypox that we have known for some time? But I think at this point, the general population, the concern should be on the low end. Just keep your radar up, kind of, especially if you see those swollen lymph nodes or a rash. But I don't want anyone to worry because this is not nearly the level of concern that we had with COVID, which was a new virus, no vaccine. We have a naive population and it was spreading through aerosols.
Dr. Kohli, can I put you on the spot here for a quick second?
Sure.
Can I 1 to 10 you? 1 to 10 you're concerned about monkeypox, with 10 being the most concerned,
Okay.
and same with COVID right now.
I would say COVID's probably a 7.
Okay.
And monkeypox probably a 3.5.
All right.
Can I do halves?
Yeah, you can do half. You can do whatever you want. I put you on the spot there, so that helps. So you are notably less concerned about monkeypox. I'm not even close.
Significantly less concern. And my concern with COVID, again, is not necessarily so much overwhelming the system, but just the development of long COVID, preventing the spread of the infection so we avoid and truncate the likelihood of new variants, the development of boosters that are variant specific, all of those things. And then obviously the antiviral Paxlovid for the general population. These are things I think we need to prioritize right now. Monkeypox certainly very important, but we're seeing it at such a small scale. And the spread is not seeming to be very efficient that I think it's probably, hopefully, something we can get on top of.
All right. I hope you're right. I mean, it sounds reasonably, I wouldn't say optimistic, but it doesn't sound maybe as pressing as, say, February of 2020 or something like that. So
Definitely.
I think a lot of people may be a little bit on edge because of
They're kind of worried that we're having deja vu again. But like I said, I think the vaccines being on our side, having had the virus around for many years, and then also identifying these cases early, I think that's very important.
Good to know. All right. Well, Dr. Payal Kohli, thanks so much for your time and giving us a bit more insight about the monkeypox. Again, appreciate a few minutes of your time here on News Plus.
My pleasure.